hope you found the sessions useful and you've had a bit more time to reflect on the lectures as well as the exercises from yesterday, particularly to understand the data situation in your own country better. In today's lectures, we are going to delve a bit deeper into assessing data for usability. So we will begin with understanding the complexities around measuring birth and death registration completeness. And then we'll go a bit into the metadata issues and how metadata could differ across different data sources. And if it does not align, then what should be done in those situations. And we will also discuss how to assess data quality, what to do if there are gaps and deficiencies and inconsistencies in data across sources and over time. So we're going to deal with the nitty-gritty of the data itself today. And we have about 3 lectures lined up for today and a couple of exercises. So hopefully we should have a bit more time for discussion as we go along. And we will continue to use the tools from yesterday. We encourage you to keep posting your messages and your comments and your questions in the chat box. We also encourage you to use the Jamboard. But today we would also encourage you to raise your hand and take the floor. So, when we come back into the plenary discussions after you've had time to reflect on the exercises, please feel free to use the hands raise option and take the floor to make any quick comments or provide your feedback to the questions. So with that, I'm going to give the floor to Renee to take this on. And if you have any questions at the outset, please feel free to raise them now, especially if you've had a chance to reflect on the lectures from yesterday and if there's something you want to clarify before we get started for today, then maybe we can spend the first 5 minutes doing that. So thank you once again for joining in, and Renee, over to you.
Thanks, Sharita. Good morning and good afternoon to everybody. I don't see any comments as of yet, so I'll keep an eye on the chat box and see if there's any as we go along. So perhaps in the interest of time, to make sure we have discussion for today, I'll go ahead and get started with the lecture. Okay. Okay, so hopefully everyone can see my screen. Just let me know if for some reason you can't.
Yeah, we can see it.
Perfect. So as Sharita already mentioned, we're going to be talking about examining our data for data quality and for usability. And some of the things that we'll go over today are considerations when using data from existing household surveys, some of the complexities of measuring disaggregated birth and death registration completeness, discussing if your definitions align sufficiently between your different data sources, if you can use the data for analysis, and finally, how to assess the data for quality and determine if it's usable for analysis. So we'll start with lecture 7. And the first thing we're going to talk about is survey data. So a lot of you mentioned that you have already had household surveys such as a DHS or mix, and many of them have disaggregated when examining birth registration completeness, which is great because that already provides some of the evidence you might need to do an inequality assessment and to start to think about who might be left behind and some interventions that could be done to improve their registration. If the results are published, you can review the data that's there and kind of consider the different groups that are presented and again come up with recommendations for improving registration for some of the marginalized or disadvantaged groups. However, even if your report perhaps is only nationally representative, maybe the sample was drawn in such a way that it didn't represent geography or certain subpopulations, sometimes there is a data set available, and depending on how the sample was drawn or how big that sample might have been, it might be possible to use that data set and disaggregate a little bit further. So reports and data sets from surveys are useful to understand variations in registration completeness, but we always need to be a little bit cautious. And this is especially the case if anything is mentioned in the methodology of the report, or perhaps if you request the data set, if those collecting the data or the data providers explain that maybe that the sample wasn't robust enough to cover certain regions or populations. So we need to make sure we always check the methodology and kind of understand how the survey was done before we draw too many conclusions from the data. So for example, there have been some surveys in the Pacific where really far outer islands have just been taken off the sampling frame table. So they weren't even included in the sampling frame because it was just too costly and too time consuming and just really challenging to get to those islands, and perhaps they had really small populations. So in which case, technically those surveys wouldn't be nationally representative because there were some islands that were outer islands that were excluded from sampling frames. And so sometimes certain regions are excluded from sampling frames, maybe if there's conflict or maybe there was some kind of a natural disaster emergency, they weren't able to be reached. And in those cases, the survey wouldn't be nationally representative. So we want to understand what areas were and were not included. Also, we want to understand the sample size, perhaps of households of a certain region we're interested in. Was it large enough for us to have confidence in our data, especially if we're looking at specific subpopulations or ethnicities? And we want to also understand the response rate. So perhaps there were certain groups of people, maybe certain ethnicities or nomadic populations, single mothers or women-headed households. They might not have responded to the survey. They might not have been home when enumerators came. And so their representation in the survey would not be as robust as, say, some other populations. And so we want to know what the response rate was of the subpopulations we're interested in. And then we also are interested in how the survey was done. So in some countries, the DHS only interviews married women. So you could be a mother, but if you're not married, you wouldn't be included in that sampling frame. Similarly, it only includes women aged 15 to 49. So you could be younger than 15 and be a mother, but you wouldn't be included. And you could also be older than 49 and not be included. So it depends on how the survey was designed and who they chose. So it's important to understand the methodology of our survey. And we just want to check, based on all these different factors, who might have been left out. Sometimes, though, we don't have a household survey and there is no existing data, so we need to perform the analysis on our own. And we talked a little bit about this yesterday. So we're looking at the registered events in the numerator, and then we're estimating our denominator from other sources. And so there's different ways that we can do this. The direct calculation, where you have your registered events, so in this case it's deaths, and here it says actual number of deaths, but we're still estimating because we don't know. We're using the best source that we think that there is, which we might call our gold standard. And there's different ways that we can choose our denominator. And so for the purpose of this workshop, we'll be doing direct calculation, thinking about that methodology. So for example, a lot of our data would come from administrative data sources, but perhaps sometimes it could come for a census or a survey. We discussed really briefly yesterday that there is some indirect demographic methods where you can use two censuses to estimate the midpoint number of deaths. But we won't really be discussing that in the workshop, but it is an option sometimes to get the denominator for estimated deaths. And finally, there's also capture-recapture methods where you also are trying to estimate the number of deaths through a survey and returning to the field. It's a bit complicated. We won't go into the methodology here and we won't be discussing it, but I did just want to mention that it is a possibility as one way to estimate your deaths. And we discussed yesterday, there's a number of sources that we might use for births and deaths. And here there's some sources listed, such as recorded births from the Ministry of Health, if there was a census that inquired about deaths, if there was any kind of household surveys, Or if we don't have those things, we can use the UN World Population Prospects or other things such as I believe the Global Burden of Disease estimates, I think, by sex. So we'd have to check that information. And we also talked about yesterday, when we're doing an inequality assessment, we need a lot more detailed information. So this really starts to limit what we can and cannot do. So we're going to talk a little bit about the complexities of measuring birth and death registration completeness. So here our example is about deaths, and we're looking at the year 2020. And so intuitively, we kind of understand, okay, the death would have occurred between January 1st and December 31st in 2020, when we're examining 2020. But when was it registered? So this is a tricky question. There are several different options we can kind of think about. So if your death occurred in 2020, you can think about it as the same year of, so the death and the registration occurred in the same year. So in that case, the death would have been registered sometime between January 1st, 2020 and December 31st, 2020. But that poses a few challenges, because if you died January 1st, you have essentially 365 days to register in order to qualify for this kind of analysis. But if you died at the end of the year on December 31st, you essentially only have 1 day to register that death. And so you're a bit biased towards those deaths in the beginning of the year. So you're less likely to capture those at the end. Why you might use this method is because it's pretty easy to measure. Maybe if you don't have a lot of technical expertise to pull things from a database or calculating new variables, it's straightforward, it's easy to understand. It's pretty timely. You don't really have to wait a whole nother year, an extended period of time. So after 2020 ends, you can just pull the data from the database and analyze it. But as we mentioned before, it does have some drawbacks because it's kind of quote unquote inequitable towards those deaths that occur at the end of the year. It's less likely to capture them if there's any kind of delay in registration. And it's also unlikely to include the allowable legal time frame for registration. So in many countries, perhaps you have 7 days or 30 days or 6 weeks or whatever the law says in order to register a death. So if you died December 31st, I don't think most laws only give you 1 day to register a death, especially if that happens to be a weekend, say a Saturday. And so it doesn't actually quite align with what you might have in terms of the allowable time frame to register. A second option might be looking at deaths registered at any point in time. So again, if we're talking about 2020 deaths, the deaths that occurred in 2020, they could be registered in 2020, they could be registered in 2021, in 2022, in 10 years from now, and like say 2032, we could look at deaths and they could have occurred in 2020. So we're not putting any kind of limitation in terms of the delay in when they occurred. But if we were looking at, in 2020, in 2010, if we looked at 2010 deaths, the registration rates might be low. But then if we, over time, so say now in 2022, they would be a lot higher now than they would have when we examined them in 2010. Maybe not a lot higher, but in theory, you would get more because people have more time to register. So in that 12-year interim period, your completeness would have gone up. Especially if you compare that to option 1, where you just look at those registered the same year of occurrence. And I'm just putting a little note of caution here. This kind of applies to all these different options and ways of looking at things. Just make sure when you're pulling your data and examining it, that you're looking at the year the death occurred, as opposed to the year the death was registered. So sometimes it's easy to accidentally pull the wrong variable from your database. So you just want to make sure you're looking at the deaths, the year of occurrence. So if we look at option 2 for registered at any point in time, so allowing any kind of delay, it's very easy to measure. It's also very timely because you can pull the database at any point in time and just look at the deaths and say pick a year and do the analysis. But the cons are that your measurement is going to change over time. So with each passing year, your completeness would change. So if you look at deaths in 2010, and when you examine it that same year, maybe it's 30%, and in 2011 it goes up to 35, and in 2012 it goes up to 40. And so you have this metric that's changing over time, even though those deaths occurred in the same year. So that makes it challenging to make comparisons either internationally to other countries or even within your same country over time to understand how your system is improving, because you want to know each year your registration completeness, how it's improving over time. And so here's our third option, and this is what we will kind of be going with in the workshop. So we'll look at, say, registered within 1 year and the time of occurrence. And you could do this really for any point in time if you have a certain legal registration timeframes, be it 30 days or 7 days or whatever it is. You could also use that as well. 1 year is just kind of like a nice, easily understandable metric, and a lot of countries do use it, so it makes it easy to do international comparisons. And if you keep that metric, you can compare over time within the same country how registration is improving. So in this example, if you die January 1st and you have 1 year to register, you have all the way until January 1st of 2021. And then similarly, if you died December 31st, 2020, you would have all the way until December 31st, 2021 to register that death to be included. So this is a nice way of examining things because your measurement isn't going to change over time for a given year. And it's easier to make comparisons internationally or within the same country to understand how registration is improving. But it is a little more challenging to measure because you're going to have to calculate variables to when you pull your data. So you have to look at, exactly 1 year from the death to make sure that those are the specified delay period. And it's not going to be as timely because if the person died at the end of the year, say December 31st, you have to wait an entire year to give them that time period to register in order to collect the data and to analyze it. So again, you could make this metric anything you wanted. It could be 30 days or 1 week or whatnot. But whatever the delay period, you would have to wait a little bit of time in order to have that allowable registration period before you're pulling your data to do your analysis. And you might ask, well, okay, that's the numerator for registration. When were they registered? We're going to use within a year of the date of death. You might ask, well, what about your denominator? And our assumption is, in general, there isn't much delay in the denominator, especially when we're talking about recording deaths. We would assume that they would happen very close to the time of occurrence in the facility, in the health facility, if that's what we're using in our denominator, or if we're using, say, cemetery records or police records or something like that. We would, if it has administrative purposes, then we're kind of making the assumption that delay isn't really something we need to consider. If you know that for some reason it is in your country, then again, that might change things and you might have to think similarly as you did with the numerator. But for the purposes of this workshop, we're just going to focus on the delay in the numerator. The examples we just covered were death registration, but birth registration completeness would be very similar. So again, you would say maybe you have 1 year after birth, or so someone had asked about the SDG 16.9 yesterday. This would be similar because essentially you're giving that child 5 years, like a 5-year delay to register because you're looking at children under age 5, the completeness. But again, you just have to make sure your numerator and your denominator match for births for that 5-year period. And similar with births, we would generally assume our denominator isn't too affected by delay. We're really focused on the registration and the delay in registration. So estimated births through Ministry of Health databases, such as if we use, say, birth notifications, or maybe we use vaccine registry, in general, often these are made at the time of occurrence. So when the birth occurs, that's when the notification is written. When a vaccine is administered, that's when it's put in the database that it occurred. So often these things do not experience delay. And then if you were using estimates from, say, surveys or census or UNWPP data, delay would already have been factored in. It's not something you really need to worry about when these numbers are created and reported. So I'll pause briefly there and see, check the chat box and see if anyone has any comments or questions thus far. Where can we get data on actual deaths without a survey and without other sources of data too? So if a census didn't inquire about death and you don't have any surveys, and your Ministry of Health doesn't have complete recording, if it's very low, then one of your only options might be to use the UN World Population Prospects. And I would encourage you, I believe in my slides today, there's a link to Tom Moultrie's series of lectures that he gave in May, I believe, of this year, which are very helpful thinking about how to use that data. And it's very technical, but you can do some analyses at least by sex and I believe by age. So there are some options for countries that have no data. And the other option is you might consider perhaps in a really large urban city or in a capital, perhaps you have a large hospital that collects a lot of information, or often in urban areas, some kind of records are needed, permits are needed for burial. And so to perhaps just investigate within a small urban area region, there might be some things that you could do in that respect. Okay, any other questions or comments thus far? All right, well, let's see here. How do we factor in the delay in calculation? Do you want to maybe go ahead and ask the question, maybe unmute yourself about the delay in calculation? You can ask in a little bit more detail. Our colleague from Rajasthan, do you want to unmute and maybe ask the question about the delay?
Yes, ma'am. In the last slide, ma'am, there was a point that generally these are the factors of surveys or census. When they calculate the data, they calculate the populations or the birth registrations completeness. They take into a consideration the delays which have already happened, the delayed registration of births as well as death events. My question was, what is the formula which is generally adopted to calculate 2010 and is getting registered in 2020 or 2019? So there is a delay of 9 years, and 2011 or 2012, whatever, because that delay was already there and that event was never ever registered. So in what way that has been calculated into the calculation of total population or the completeness of the registration?
Okay, so I think there's a slight misunderstanding. What I meant was they're not calculating, so UNWPP wouldn't be calculating completeness per se. What they're doing is perhaps giving you an estimate of births. And so they can do births by sex, male and female. So what I meant was if there was any kind of delay, for say you're looking at 2020, their estimates for 2020 would have factored in, you know, like the way they calculated their data, they would have put it so it's at the midpoint of the year so that they're not, you know, delayed for 2019 or 2021. You don't really need to think about it when you're using that data for the denominator. That's what I was trying to say. It's the numerator in that case when you're looking at registered births or deaths from your civil registry that you really need to think about in terms of delay. Does that make sense?
Oh, sure. Thank you.
Okay. Let's see our other questions. Okay. I believe this is our colleague from Thailand. Do you want to ask a question about who should be included or not included?
Yes.
I think that you were unmuted, but now you're muted again, Wishad. Do you want to try try again?
Okay. My question is about the birth and death data that collect in Thailand. All case of birth and death will be registered not only Thai people, but it also include non-Thai people. So my question is, when we want to calculate the completeness of birth and death data, we should include the foreigner or not in our nominator and denominator.
So that's a very actually interesting question. So the first answer would be, no matter what you do, your numerator and your denominator need to align, right? So if you do include the foreigners in your registered events, then they need to also be included in the denominator. If for some reason, either the numerator or the denominator, you're missing those, you don't have information on foreigners, you can exclude them, but you just have to be very clear in your report or your analysis that this is only Thai people, or perhaps it would be very interesting, I think, to look at non-Thai people for foreigners and say, you know, we did this analysis on foreigners and here's what we found for completeness versus Thai people. So I think that it would be great if you could do it for everybody and then break it down by Thai and maybe non-Thai. But whatever you do, just make sure your numerator and your denominator align as best as you can. And maybe it's not perfect, and that's okay, but just document what you did and how you did it. And that's the most important thing. But that's a very good question.
Okay, thank you.
Yeah, thank you. Other questions? Okay. All right, so we will keep going, and feel free as we go if you have other questions or thoughts to put them in the chat, and we will move on to our next lecture 8. Okay. So now we're going to start getting into more detail about our metadata and if our definitions align. And we had this slide yesterday, and we discussed all the different variables that might affect registration and all the different variables we might think about capturing. We're not going to go all over all of those things, but we're going to go over some of the common ones and use this example, and we'll go back to our fictional country of Poplandia. So we need to ask ourselves, do the metadata align across our different sources? And if not, could we create perhaps new variables or use some kind of proxy? Is there something we can do so they do align? And so in this example, we have registered death data from our civil registry, and we have recorded births from our Ministry of Health. So in terms of sex, the registry only has 2. They only collect male and female. The Ministry of Health has male, female, and other. The registry has single years of age for deaths, but Ministry of Health only has age groups, so say 10 to 14, 15 to 19, etc., but they cap it at those age 80 plus. In the registry, there's only 2 categories, so let's say Indigenous and all other ethnicities, but the Ministry of Health actually captures 4 ethnicity categories. And then finally, our civil registry, in general, they would use standard administrative boundaries, what's accepted in the country. However, for the residential address, they capture it as a free text field. So it's all just kind of entered and typed in. For our Ministry of Health, they don't capture usual residence, but they do have a field that has, say, province or district for the health facility, but these boundaries don't align with the administrative boundaries of the country. So we already see that there's some issues here between these different variables. So looking at just the sex, the male, female don't exactly align across sources because the Ministry of Health has an other category. And so one of the things we might want to ask is the other category, is it really other, such as intersex or maybe someone who doesn't identify as male or female? Or is it a category that is just for, they didn't know, or they didn't have the data, or they just kind of, you know, it was a typo, they entered it in there somehow. So what does other mean is the first thing we want to understand. And it would be helpful to understand the percentage of records that use the other category, or maybe how many are blank in general. And so in this case, unless other was really just kind of a catch-all for blank, we wouldn't really be able to recode those into male or female. It doesn't make sense. And so which case we could only do our analysis on male and female. So the likelihood is we would probably only be able to look at male and female, and until the Civil Registry also created another category, this isn't something we could examine. And then going on to age, because the Civil Registry only has single years of age, and the Ministry of Health has age groups, and let's just say maybe they don't have date of birth for whatever reason or date of death, we are going to have to make these align. And so we would have to recode and create a new variable for the age so that they align, such as 10 to 14, 15 to 19, and then to cap our highest age group at 80 plus, so that these are then the same and we can do analysis that way. And just a little note here when we're talking about age, particularly for infants, it's important to understand if your data set has stillbirths. So both from, usually the Civil Registry wouldn't, because in general, we don't usually register stillbirths with birth certificate, et cetera, but the Ministry of Health is likely to have stillbirth data, and we need to understand if our data includes that. So stillbirths are really important to record and report in their own right, because we need to know how many are occurring to put in interventions and during pregnancy and deliveries to prevent stillbirths. However, to align with international standards, we cannot include stillbirths in our registration completeness calculations. So by definition, it only includes, you know, a baby who was a live birth, took a breath, had a heartbeat, et cetera, and then subsequently died. So you would have to filter out the stillbirths in your Ministry of Health data set. And just an example here, if you can see that 26% of this infant data is actually stillbirths for the Indigenous population and 39% for the Marzians. So if we didn't take out our stillbirths, we would artificially inflate our infant mortality rate, and we would also decrease our completeness and death registration completeness, because these stillbirths wouldn't be registered and our denominator would be higher than our numerator. So you can see how in cases where stillbirths are a significant proportion, it's really important that we take them out of the analysis and that we inquire from our data providers if they're there and to make sure that they aren't included. Okay, moving on to ethnicity. We first want to ask how each of these categories are defined, make sure that the definition's aligned or that they're close enough that we aren't going to have very large discrepancies. So in our example, we said the Civil Registry had two categories, Indigenous, and then everybody else is lumped into all other ethnicities, but the Ministry of Health has Indigenous, Marzians, Mercurians, and all other. And so what we would need to do is we would need to take all three of the categories from the Ministry of Health, so the all other, the Mercurians, and the Marzians, and recode them into a new variable so that there's all other and then Indigenous populations. So unfortunately, in this case, we can only really do our analysis on Indigenous and all other ethnicities because we just don't have the data from the Civil Registry. However, this has a very important policy implication. So we want to make sure that we document this in our report and provide a recommendation that the Civil Registry increase the number of ethnicity categories that it collects. And so maybe it's something as simple as just adding another field in the form or the database, and that would greatly improve our analysis in the future. So the next time we do an inequality assessment, we can really dig a little bit deeper and understand if there's any disparities in registration between these different populations. And finally, we'll come to geography, and we can see here that there are multiple problems with our geography. So in this up here, as I mentioned, the Civil Registry has an open text field. So everything is just kind of typed in and thrown together. And as we know, this is often prone to error, often prone to be left blank. Sometimes it's nonsensical, and it makes things a bit challenging. And then down here, we have the Ministry of Health database, and they do not collect residency data, but they do have facility. So here, for example, they have the division of facilities, and if it's in the eastern or the western or the southern, but that does not align with the administrative boundaries of the country. So up here, so for example, if this was Eastern Province in Paplandia does not align with this down here. And so these are not apples to apples, unfortunately. What we would need to do is we would need to first recode the text box into, say, district, division, province, whatever we were going to use. But this might not be possible. It depends on the technical capacity of those involved. It also depends on data quality. If you have 100,000 records, obviously you don't want to do that all by hand. You would need to write some kind of computer program. So this may or may not be possible to recode and actually use the data. In terms of the Ministry of Health data, perhaps they have GPS coordinates for where the facility is located, and they have some kind of mapping, say, spreadsheet that can map the boundaries of the division to align with the administrative boundaries of the country. And so there might be a way to recode this and to make a new variable. But it's also possible that if it's just GPS points, it could literally just be the point of the clinic, and the surrounding area that normally would be included in what they define for their boundaries is a bit unknown, or they don't have it in GPS, so there's no easy way to transfer it. And so a little bit more investigation would be needed to see if you could use that as a proxy, or how far off maybe the health boundaries are from the administrative boundaries. Perhaps you could just look at urban areas, because if you were in a capital city or a very large city, it's more likely that those areas of the health division would align with, say, the administrative boundaries generally used in the country, or perhaps close enough that you could align it and use it as a proxy. So in this example, a lot of work would need to be done in order to do geographic analysis. It's not impossible, but it might not be likely depending on the technical capacity of Paplandia. So we kind of talked about this yesterday, but your investigations and what you find out, and as well as your partnerships with data providers, will determine what you can and can't do. And it will also help inform what you end up analyzing in your inequality assessment. So it's very important that we make a note of what is not being collected. So the example of the ethnicities from the Civil Registry office was one, or maybe where definitions don't align, so that this can be improved in the future, and better data can be collected in more detail, and we can do better, more in-depth inequality assessments in the future. So I'm going to stop there and see if there's any comments or questions before we start and move on to the exercise. And we're actually right on time, which is amazing. Okay, well, if there are no comments or questions thus far, Panita just put the link to the Google Drive with the exercises in there. It says exercise, oh, day 2. Okay, not exercise. So we're working on exercise 3. And so what I think I might do is I'll pull it up on my screen and kind of go over the first part. And maybe I'll give everyone 5 or so minutes to think it over and work on it. And as you're doing that, if you can put your responses to the Jamboard as you're starting to think this through, that way you have a few minutes to think about it and post to the Jamboard and do it kind of a little bit at your leisure. I think that might be a good way. And then we can come back and kind of discuss the Jamboard and the exercise together. So let me pull up the exercise. As I mentioned, we're looking at exercise 3. And I will, okay, so let's talk about question 1 to begin with. Let me see if I can also zoom in a little bit here. Hopefully you can kind of see this as well. So again, this is on the Google Drive with the link that Panita just posted, exercise 3 on day 2. So the first question is, let's say there's a recent DHS in the country of Paplandia. The DHS inquired about birth registration completeness to mothers in the survey. The DHS dataset can be disaggregated by various ethnicities, including the Mercurial nomadic population. However, the DHS report methodology specifically states that the sample was not drawn in such a way to factor in the nomadic movements of this population and may not be representative of this population. Further, the response rate of Mercurial nomads was very low, below 50%. And this is because the households were not present. So when the enumerators went out to interview the households were not there. They had moved on because they're nomadic. And the interviewers just were not able to find them. So, and when you look at an actual count of mothers in this population, they're also very low in the 15 to 20 range for some of the variables of interest. And they are not published in the main DHS report. So just kind of reflecting on this information, can you use the DHS dataset to assess inequalities in birth registration in the Mercurial nomadic population? So if we have a think about this information, process it a little bit and see what you think. And then if we can go to the Jamboard, we can, let me just check and we can see what, let's see, where did I end up with that? There we go. Okay, it looks like we are on slide number 10. And it's also labeled exercise 3, question 1A, asking if we can use this DHS data set. And so have a think about it, and then you can make your little sticky and post it maybe yes with caveats, or I don't know, or no, and here's why. And then we can kind of discuss the results a little further. So I'll give you about 5 minutes to think it over and make a sticky note. All right, I'll give everyone about 1 more minute to post your sticky note, and then we'll go ahead and discuss the first question. Okay, so we have about 1, 2, 3, 4, 5, 6, 7, 8 sticky notes, 8 brave responders. Thank you very much. And the consensus by everyone is basically no, and for various reasons. And that's correct. I mean, the main reason is when we have really low numbers of mothers, such as say only 15 to 20 mothers that were interviewed, it's just too low to draw a strong conclusion. The methodology warned us against this. It said the sample wasn't drawn in such a way to capture this nomadic population. But there may still be some use for the data. So let me share my kind of quick little summary here. So while we all agree the sample is not robust enough to factor in this population, and again, the sample size is under 30 mothers, it's just too low. Common sense does tell us that this population is likely to be disadvantaged. They live in a remote area, they're nomadic, they probably have inconsistent access to registration offices, they might not have identity documents themselves, etc. And so in some ways, there could be some use in this data set when we think about triangulating. So if we did do some analysis and we did find that, say, we did our own analysis and this data set and maybe another source all kind of pointed to the same thing, low registration rates, that helps to reinforce the findings of one another. But more than likely, we're not going to be able to use this data, unfortunately, and we're going to have to find other sources for this particular nomadic population. I'm also going to quickly just talk about this bonus question here. So I asked, what other factors might you consider? And we kind of discussed this in the lecture. So the survey might only interview married women or mothers. And so if a woman was a mother but she wasn't married, she would be excluded. And we might be particularly interested in those women because they might already have barriers to access the registration of their births. Say if you need a father's to be present and on the birth certificate, or maybe you need a marriage certificate or other documents, then sometimes it can be even more challenging for unmarried mothers to register births. And again, we talked about age. If the woman is under 15, if maybe she's very young, or if she's older, then she is often excluded in these types of surveys. We would just have to understand who was and wasn't included in the methodology. Sometimes they do include young women if they're mothers or older women. So it just depends on the individual survey. We would want to know this. And these can all have implications, particularly for young mothers. They could perhaps be disadvantaged. So I will quickly go over or read question 2, and then I'll give you guys again a few minutes to think it over and assess. And then if we could go to the next slide on the Jamboard, I think the next slide is, I'm not sure what number 10. And then you can post or sorry, it was actually, I think it's number 10 was the bonus, so slide 11. Okay. So question number 2, Poplandia has done some more research. Now we're switching to death completeness into deaths data sources from the Civil Registry and Ministry of Health to estimate completeness. They're particularly interested in completeness by age. The Civil Registry has a field for date of birth and date of death, but the civil registry does not have a variable for the age of the decedent. The Ministry of Health has the age of the deceased coded into 5-year age groups, for example, 40 to 44, but they don't collect data on date of birth or date of death. So the question is, can analysis of death registration completeness by age be done? And if not, what other considerations or proxies need to be explored to use these two data sources? So I'll give you, this particular one is pretty quick, so I'm going to give you maybe say 3 minutes to think it over and put a sticky note on the Jamboard, and we will circle back and discuss together. Okay, so we have a lot more responses this time, which is great. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, somewhere in there. Again, we're coming to the consensus of yes, which is fantastic. So maybe I think I just saw the Philippines worded it quite nicely. So yes, the civil registry can compute the age based on the date of birth and death, then convert into 5-year age groups, and that will align with the Ministry of Health data. And that's pretty much what everyone said here, which is exactly correct. So yes, it is possible to do it by age. They would just need to recode into a different variable. So fantastic. So let's now go to exercise 3. I will share that one. We'll review it together. So the third question, that is. Okay, so question number 3. As the inequality assessment progresses, the Civil Registry Office has provided death registration data for the entirety of the country, less the Eastern Province. So the Civil Registry was not able to provide data for the Eastern Province. However, the Ministry of Health is only able to provide data for its main hospital in the capital. So the only data they really have is from their main hospital in the capital. So can any analysis of death registration completeness be done? And if so, what? So I will give you about 5 minutes or so to think it over and put your thoughts on the Jamboard. So now we are on, let's see, I think we're on number 11, the next screen. And I can share that so we can see as we go along.
challenge for us and not for others? Why it is the opportunity for us and not for others?
We'll take maybe one more minute to summarize our thoughts, but I wonder if anyone maybe would want to volunteer to discuss or present a little bit more about what they're thinking. Feel free to raise your hand or mention the chat box if you're willing to share your thoughts. No pressure. Okay, so I think a lot of you have already responded. Overwhelmingly, we're seeing a lot of yeses, and then we have a few nos. And based on some of the responses here, both camps are kind of right. I think maybe some of you should have been lawyers because you kind of caught me on the language of my question. So some of you had mentioned, well, you can't do death registration completeness for the whole country, which is true because you're missing some regions. And some of you mentioned, well, maybe you can use something else for your denominator or some other kind of, information or data, which is also true, but that wasn't quite what I was going for, but I didn't specifically say that in the way that I worded the question. So what I was trying to aim at is, let's say we only have this data from the Civil Registry, and then we only have this data from the Ministry of Health, and it's only for the main hospital in the capital. That's all we have. We have nothing else. We've done everything we could to find data, and this is what we're left with. So what can we do? So let me share my summary here. I think that might be a little bit more helpful then. I'm trying to just... Okay. So a number of you did mention proxies. And so what I was kind of getting at here is yeah, the data from the central hospital could potentially be used as a proxy for deaths in the capital. So we know it's not perfect because we'd have to try to do some investigation or some understanding of how many deaths in the capital are recorded in that main hospital. So for example, if someone died at home or they died in a road traffic accident out in the street, is the body still brought to the hospital? Is there still any kind of documentation? If yes, then it's likely that maybe there's a lot of records in that main hospital and we could use them. If no, if you die at home and there's no information in that main hospital, we might be out of luck. So we do need to do a little more investigation, but it's quite possible that we would be able to use this data, because often in urban areas we're more likely to capture some more of these records through the health system. And so again, based on what the registry or the health system disaggregates by, say, sex or age or ethnicity, we could do our analysis in this way. But the most important thing is that we explain in our methodology our assumptions, any proxies we use, maybe some caveats or whatnot we might need to consider. And so, I'm sharing the answer for the next one, but so if we did do this, some of the things that we might want to be aware of. So I'm not sure if, hopefully you didn't see my answer too much, but maybe just think about this. So let's say that we do use our civil registry data for the capital city, registered deaths in the capital. And then we use our Ministry of Health data for recorded deaths in that central hospital. And we're going forward with a proxy. Let's assume that that most deaths, say if you die at home or in the community, the body has to come, or you have to get documentation through that hospital. So there are records. What are some of the caveats we might have if we do this proxy? What are some things we might need to consider? So let's take another, say, 5 minutes and summarize our thoughts to think about if we go forward with this methodology, what might we need to factor in? And that's the next slide on the Jamboard. I'll share that in a minute. We have a lot less responses on this one. Maybe I'll give you 1 or 2 more minutes to kind of think it over and summarize if any sticky notes. If anyone, again, wants to perhaps volunteer or share some thoughts or discussion, please feel free to raise your hand and let me know. We'd love to hear from you. We'll give us 1 or 2 more minutes to kind of wrap it up for this question. Anyone want to volunteer to share their thoughts on this? Maybe it was also slightly tricky trying to, it was kind of a very vague open question. What should you consider? So what I was kind of, I think what I was getting at, part of it, our colleagues from Turkey here hinted at this. So we're thinking about usual residents, right? So we're making a proxy. I guess it wasn't entirely clear on the registered desk. Perhaps we do have residents there, but the hospital, it's a proxy. And so by assuming that those deaths from the hospital are from the capital, we're making some assumptions. So this blue sticky over here also kind of gets at it. It's quite possible that you lived in the capital, but perhaps you traveled elsewhere and you died. So that means you would be excluded from the hospital death. So we might be missing some of those usual residents that actually died somewhere else, but we do care about them. Conversely, perhaps people in remote areas or without access to healthcare came to that major hospital, maybe for specialized treatment, and they died there. However, they're not usual residents of the capital, and so they wouldn't necessarily have their deaths registered in the capital. So the numerators and denominators might not match in that respect if they are not usual residents. So we're kind of making some assumptions about who these people are and who those deaths are. So if we could do some more investigation, if there's any way to kind of understand how many people coming to the hospital are coming through the hospital to get recorded their deaths for whatever reason are usual residents of the capital, how many of them are from other places, and then also trying to understand perhaps how many residents of the capital might have died elsewhere. That can help inform some of these decisions about how sound the data is and if we should go forward, and maybe some caveats or things that we need to consider going forward. So let me just have a look at some. There's a few more notes. Let's see. So yeah, I mean, most of you are kind of saying it needs to be taken with a little bit of caution because we are developing a proxy. And I like this comment here, all limitations need to be well documented in the report. So yes, that's absolutely critical. That's what we keep getting at. So we're clear about where we came from. So does anybody have any questions or comments thus far on the exercises or any of the lectures? We are actually running, oh no, we're about right on schedule. So we were meant to have about a 10-minute break right about now. So why don't we go ahead and do that? We'll break for 10 minutes and then we'll reconvene at, what would that be, Thai time? I'll let Panita put up the timer, but we'll come back at let's see, 35 after. And then we'll go from there, we'll go into lecture 9 and continue. And feel free if you have any thoughts or comments to put them in the chat box. Otherwise, we'll see everybody back in 10 minutes. And I will also, during the break, upload the quote unquote answer, kind of my thoughts for this exercise 3 into the solutions on the Google Drive in case you want to look at those and have a little bit more detail or understanding of the exercise. Okay, colleagues, our 10 minutes is about up. So why I don't see any additional questions in the chat box, just a request perhaps to share the drive, which maybe Panita can do. So why don't we keep moving on, and we will continue with our lecture number 9. Let me share that. Start at the beginning of lecture number 9 might be helpful. Okay, here we go. So we have looked at the definitions, our metadata. We can see that they align. And then once we start to look at the actual data, how do we assess the quality? And we'll discuss that a little bit in this lecture. So if you're using unit record data, it's likely that you're going to have errors. It's just part of life. And if I haven't mentioned this before, when we think about administrative data, I think we talked about this yesterday briefly, but the purpose of administrative data is to fulfill administrative purposes. So in this case, to provide a birth or a death certificate. Ministry of Education enrollment data is to track students and understand how many are in schools and to do some planning. Same with vaccine data. It's kind of really to help programming and whatnot. It's not collected for the purpose of statistical analysis. This data is great to use for analysis. We need civil registration data for vital statistics, but its primary purpose is to serve the citizens, provide documentation, and the secondary purpose we use for vital statistics. So in that way, administrative data has more errors than, say, if you were to do a census or a survey, which the primary purpose of a census or a survey is to collect data. It doesn't really have administrative purposes. It's really just to get data and information. And so, some more caretaking is done in terms of data collection and cleaning and whatnot when you have something like a census versus administrative data. So the reality of life is that when you get administrative data, you are going to have some problems in your records. So here we're looking at death registration data, and we can see a whole bunch of people here that their date of death registration occurred before their death. So they were registered, say, 10 or more years before they actually died. And that doesn't make sense, right? So something is going on with this data. We're not sure what, but there are definitely some errors going on here. So if there, you might have a really big data set. So say you have 100,000 records. You can't fix them all. So if they all have errors, you're probably out of luck. You probably need to throw out the data set. You probably can't even fix 10,000 of them. If you're really lucky and say you're a small country with a population of 100,000 or less, and you have a couple hundred records of some sort each year, then yes, you could probably go through one by one and manually update them. But generally speaking, this just doesn't make sense, and it's not possible. So this really underlines the importance of collecting data correctly and completely the first time so that it's usable for analysis and can inform policy, and having a regular data cleaning policy or plan. And again, because it's administrative data, that may not always be in place. And so this is another key piece of your investigation, is to document maybe some of your findings and the errors, and to inform the data providers, the ones collecting the data, so they're aware of these things and they can improve their processes. And this might even help them inform their own programming or their own processes if they understand some of the errors that are occurring regularly. And so this is it's definitely important to document and to try to improve. So you want to know the extent of your errors. If you have 100,000 records and maybe only 100 records have errors, this has a very, very small impact on your data. It's, less than 1%. It's pretty negligible. If you have 10,000 records that perhaps are blank or have some errors, now you're starting to look at 10% of your data, which could impact your analysis. When you get up to, say, 30,000, 30% of your records, At that point, they might not even be usable. You might have to move on and start to look at something else. So I know that you're going to want to know, you're going to ask me, okay, so what points is acceptable? Like what % can I have with errors or blank or whatever? And unfortunately, there's no cut and dry answer for this because it really depends on what you're investigating, your variables, your types of data, etc. So, you know, just kind of generally speaking, 10% or less of your records with errors probably isn't going to drastically impact your analysis. And again, yesterday we said this is not an exact science. We're not trying to get this published in an academic journal. What we really want to know is with as much certainty and rigor as possible, who's being left behind and the magnitude of the differential or the inequality. Is it really large? Is it really small? Whether it's, you know, 58% versus 75%, you know, we don't need exact, but we do want to do our best. So when we talk about, you know, 10%, we could probably live with that. So for example, if you were looking at sex by male and female, 10% of your records maybe are missing this information. It's probably not going to obscure any kind of sex differential between males and females if one exists. However, say you were really interested in an indigenous hill tribe and that population only constitutes 5% or less of your total population, if even half of your missing records, so 10% that are missing, if those correspond to this hill tribe, then your analysis might not be accurate for that hill tribe population. So you would be missing information on them and you wouldn't really be able to understand registration completeness. So it kind of depends on what you're looking at. If you're looking at 50% of the population by male, female, it's probably less critical than having the potential of 10% of missing records all corresponding to a certain population or maybe half of them to a certain population of interest. So you would want to do a little bit more research and see if you can understand from the data provider maybe what's going on. So when you're doing your investigation, some of the questions you want to ask are how many duplicate records are there? Someone asked about this yesterday and we discussed it briefly. The methodology for finding them and deleting them and all that kind of stuff is outside the scope of this course. It's very, kind of IT heavy. But it is important to try to find them and to remove them because if you have too many duplicates, it's going to inflate your registration completeness, and that's not good. You also want to understand how many missing or erroneous records there are and how many can be fixed. So perhaps there are like there might be ways to impute or to like calculate the age variable like we mentioned before. Maybe there's ways around this that you can actually address, but you want to understand kind of what you're looking at. You also want to understand what % of the general population does my subpopulation comprise. So you have some populations of interest and you want to understand, is this 5%, 20%, 50% of the population, because that also would matter in terms of your missing records or data quality and that kind of thing. Give me 1 second here. I am going to try to, oops. Okay, there we go. So you can ask yourself, so based on what I know, or the data collector, because you'll be discussing with them as well, what is the likelihood that my subpopulation corresponds to these missing records? So perhaps if you're looking at a certain region, it's all a majority of a certain ethnicity, or they cover a certain age group, or perhaps there's certain indicators, like maybe certain vaccines or procedures that are given to a certain group of people by age or whatnot, that can help you identify maybe who these people are, depending on the variable that's missing. So some investigation might need to be done on your part. If all the missing records corresponded to my population, you want to ask yourself, how would this change the outcome of my analysis? How would I interpret the data differently? How would that perhaps change or influence your policy recommendations? And then just kind of think about, well, what if even half or maybe 10% of your missing records were my population of interest? How much would that affect my outcome and my findings and my subsequent recommendations? And can I live with that? Oh, PowerPoint is not visible. Uh-oh. Oh dear. Okay, thank you. All right, here, let's start again. Hold on, let me escape from my presenting mode. Technical difficulties, give me one quick second here. Go. Let me put it, so if I go to sharing, going to PowerPoint. Okay, hopefully you can see it now. I'll put it back in presenter mode. Okay, is that everyone? Are we back on track, hopefully? Okay, good. Okay, so we were talking about just thinking about if these missing records correspond to my population of interest, and perhaps it misinforms my analysis or my recommendations, and how much can I live with in terms of that percentage or whatnot. So if possible, it would be good to think about perhaps you could calculate some margins of error. So if you assume kind of, what if all the records missing were relevant to my population or a certain percentage of them, like what would the range then be for my final outcome? Maybe my completeness estimate goes from 50 to 60% instead of, 55% or 50% or whatever. You get more of a range or something. And again, if we're not interested in the exact number of, say, 50%, but if we have this range of 50 to 60% for, say, population A, but population B has 90 to 99%, we know there's quite a bit of difference between those two populations and their registration completeness, and so that we'd really want to focus our resources to bring population A over here up and increase their registration. And thinking about this, we want to think about what other sources we might have. And this might include qualitative sources as well. Perhaps there's been focus groups or some other kind of studies or findings that perhaps support the data that you have, that a certain group is disadvantaged or left behind. And again, we're trying to kind of triangulate and just support different sources to understand. And it's an imperfect science, but we're doing the best that we can. And finally, maybe our data, it's just not usable. Maybe it's not good. Maybe we have too many missing records or the information is of poor quality. And it's perfectly okay to say that the data is inconclusive or perhaps not usable. Again, we want to document this and provide a recommendation to improve data collection, be it perhaps better quality, more disaggregated, or just collecting something that's there. And it's a step in the right direction, and it's an outcome in and of itself. So even if your data isn't usable, it's okay to document that and try to improve it for the next go around. So we kind of already mentioned on some of these things we know. So for example, here we have this registration date that occurred. Let's see, what would that be? 9 years. They got their death was registered 9 years before it occurred. We know that's not really possible. So if we look up here, we can see it's actually probably a typo. It's supposed to be 2013 and didn't quite turn out that way. If we looked record by record, yes, we could easily fix this. Perhaps we have a computer IT genius that can go through and look at these kind of things. Maybe we don't. And so we have to think about what we can and can't live with. And, this top record here, this is probably a formatting issue. Maybe if we just changed it all so that it was all in one format, it would easily be fixed and show up. This record, maybe it's just something we have to live with and improve on other methods because we can't fix, say, 10,000 or 100,000 records. So if you do any kind of adjustment, be it perhaps you did some cleaning or there were some blank records and you kind of made some assumptions, maybe you took the percent distribution of ages from last year's vital statistics and applied those to the unknown. Maybe you did some other kind of statistical imputation. Whatever you did, it's just important that you can report what you did, and then also the adjusted and unadjusted numbers in your report, even if it's in an annex, just so that people are aware of the methodology behind your final outcome. So we just want to be transparent that if we use the percent distribution from another source, say previous vital statistics report, or maybe from the Ministry of Health, this is how we did this adjustment. Did we do adjustment by completeness by age or by sex? Did we do some kind of statistical imputation? All this is fine. We just want to be transparent. And it's also fine in the case of our inequality assessment, if we don't adjust for, maybe we don't have good data, we can't really know, and some of these things are just going to be blank, and that's okay too. We just want to be clear about what we did or didn't do. So another thing we really need to look at is the consistency of our data over time, because this will also inform the quality of our data. So one of the things we would look at is how has the number of registered or recorded or whatever, these different types of deaths fluctuated over time? Are there any patterns in the data we would expect to see, and do we see them consistently over time? It's important to compare our numerator and our denominator, so our registered deaths to our estimated deaths. Do we see similar patterns? Do they look very similar? Or there are things that are quite obviously different that maybe aren't explainable. And if we kind of look at the big picture, say at the national level, or even if we're just kind of looking by sex, then we can feel a little bit better about disaggregating to lower levels. If at the higher level things look pretty good or consistent, then we can feel a little more comfortable starting to dig deeper in our inequality assessment. So again, we're looking at our fictional country of Poplandia, and we're looking at, this is registered deaths, and we want to know how that they have fluctuated over time. We have from 2010 to 2020, so there's a lot of lines, a lot of different colors, but these are monthly registered deaths. And on average, we would expect somewhere around 663,000 deaths per year. So that's, I'm not even going to try to do the math, but somewhere it looks like in the range of maybe 60 a month or something. So do we see any patterns here? We do. A lot of them, it seems like in January, it's a little bit higher, it dips down, it kind of goes up, and there's kind of a lot of noise going on here. But at the end of the year, they all seem to kind of go back up in December. So for whatever reason in Poplandia, we do see some patterns. So that's good that some things are consistent over time. But we also see some, this is a little bit strange. Why is it in this year, it looks like, that 2016, I'm not sure, it's quite a bit higher, and we also kind of see it here. And then the other thing that we notice, these two years down here, these are quite a bit lower. And so these are 2019 and 2020. So, is mortality decreasing? Are things getting better? Is our population getting a lot younger? So if we don't have an old population, we're less likely to have deaths. Maybe it's the age structure of our population. Or is there something going on with registration? Maybe registration is good. So if we look at these years, remember 2019, 2020, what happened in 2020? COVID happened, right? And so if our countries say we had a delay, like a little bit of delay in death registration, perhaps maybe some of the deaths that would have been registered in the following year weren't. So these are deaths that occurred in 2019, but maybe they're just not getting registered because COVID happened in 2020, a registration office is closed and people weren't able to access it. So we just don't see the registration levels that maybe we would expect over these years. So we would want to investigate, is this due to COVID? Is this due to something else? More than likely it probably is COVID, because we are seeing some of these delays happening, and we're just starting to get caught up for some of these things. This is looking again over time. So this is total deaths from 2010 to 2020. And again, these are registered deaths. But then we're going to ask ourselves, okay, well, You know, there's a little bit of noise here, but it kind of looks like deaths are decreasing. So maybe we expect that maybe the health situation of our population is improving, people are living longer, or maybe we have like a very young population. It could just depend on the age structure and some other things going on. But overall, you know, we'd expect it's possible, let's say maybe in 2012 and 2016, perhaps there was a mobile campaign or some campaigns to increase registration. So they went out into rural areas of the community, and perhaps that's what some of these peaks are. You know, we don't really know, but overall, maybe we would expect to see a line kind of going like this, but all of a sudden it drops off. So, you know, this isn't COVID yet. This isn't COVID yet. You kind of expect a line going down. So this is interesting. So we'd probably want to investigate this a little bit more. Is our data, is it real? You know, how much can we rely on it? And how much did COVID actually also impact perhaps this bit over here? So one way we might want to do that, we can also think, you know, the delay of registration might impact some of these things. So if you looked at 2010, for example, it's a little bit closer. I wouldn't say 50-50. More deaths were registered within a year. They were doing decently well. But there was a large number of deaths that were registered. It took more than a year. There was definitely a delay in registration. But then over time, that started to improve, which is good. So it looks like timeliness of registration was improving in this country. And then the question would be, you know, is this going to continue during and post-COVID or not? But given that information, it looks like that there isn't too much of a delay. Then we want to understand what's going on over here. Why did all of a sudden our death registration drop off? So when we start to disaggregate a little bit more, you know, starting maybe with a sex disaggregation over here, we can see that the pattern is very similar, which is great. So we feel pretty good about that. It's wonderful that over time they have very similar patterns. But then when we start to look by ethnicity, you know, there's a little bit of noise, but you know, the Marzian population is very slowly decreasing. It's pretty consistent. But the indigenous population after 2016, there's quite a big fall, right? And it decreases. So it looks like something happened for whatever reason. It's quite likely that the registration of indigenous deaths decreased. And so we'd want to understand why and be a little bit cautious about our data in that respect. I also mentioned that we want to look at our numerator and denominator source over time. So here we have the Ministry of Health recorded deaths, and we're comparing them to the registered deaths, both registered within a year or those also that had some delay. And so I will ask, I'm not sure, maybe Panita has the poll. If she doesn't mind, go ahead and putting it up right now. So I want to get your feedback on this graph here, what you think. How do you feel about the data quality of this graph? Okay, yeah, so we see that the two sources share very similar patterns in death over the months. And do you think this is a good sign of data quality? Yes, no, or you're not sure? We have 3 votes for yes. 4, 5, 6. We have 1 for no. 10 for yes. 11. Oh, here, okay, we got 11. 3 for no. Any last minute stragglers want to chime in? All right, so 20, okay, good. Still going. So more than 80% of you think yes, and that is correct. So we're very happy that it shares similar patterns. So that makes us a little bit reassured that the data is consistent between the sources. So we can feel a little bit more reassured when we start to disaggregate and dig a little bit deeper. So this is what we would hope to see, that they share similar patterns over time. And if we saw this over other years, this particular year is 2018, but say we looked at 2017, 2016, we would hope that they would mirror each other somewhat, and then we'd feel pretty good about our data. So again, in this example, this is 2018. We can see that the delayed registration is pretty close to registration within in 1 year, which is good. But then our question is going to be, how will COVID impact this? Because again, this is 2018. So this gives us until 2019 to look at registered deaths. And COVID wouldn't really have an impact, but we would want to know, would that change over time? And we just need to factor that into our analysis. And so for our inequality assessment, what we're really trying to figure out are who these roughly 150,000 deaths missing that are not registered. So there's a gap here, and we're trying to figure out who is missing, who these people are, so that we can reach them and improve the situation. The examples that we looked at were mostly focused on death registration completeness and data quality, but generally speaking, the points that we talked about above would also apply to birth registration completeness as well. So you would want to look at your data over time from the civil registry, and then also compare it to your other source, such as recorded births from the Ministry of Health, or if you were using, say, the vaccine data from the Ministry of Health, to try to look at those over time and make sure that they were closely aligned, and that there weren't any years that look very aberrant or some strange things going on, especially if you're going to do an assessment on, say, a given year. In this case, we were looking at 2018. We'd want to make sure that 2018 didn't greatly vary from the years around it, that there wasn't something strange going on with the data. And then just to mention, so we've talked about before, if you have no other data sources, and perhaps the only one available is this UN World Population Prospects data that you would use for your denominator, Tom Moultrie gave a series of lectures on some methods to use this data, and he also provides some spreadsheets to use with it that you can assess completeness by sex, and I believe also by age when it comes to deaths. So I recommend, there's a link built into the PowerPoint. You can click here and have a look and go look at his lectures if you weren't able to attend, and use that process as well. So we kind of talked about deaths. We said births, generally speaking, would kind of mirror some of these things, but there are a few intricacies I just want to cover if you are using Ministry of Health data, which would be retrospective. Remember, we're looking at births that occurred maybe 6 years ago, and we're kind of also reverse surviving some children that might have died in the interim period. Ministry of Education often has school enrollment data, which you can use to estimate the number of births that occurred, say, 5 or 6 years ago. And this data is often very nice because it can be disaggregated at quite a high level. There might be information for residents, for ethnicity. They might even have some information for income or things you could use for proxies, etc. So it might provide a level of disaggregation not available in other sources. So while this will give you estimates for birth registration completeness that are at least 5 years old, it is, like I just said, it's useful because you can disaggregate. So you have to keep in mind it won't be necessarily as timely. So if you used enrollment data for 2021, it'll be at least 5 years back, maybe 6 or 7, depending on your methodology. And another thing to consider is migration in the context of your country. We talked about this a little bit yesterday, but if you have high migration, and especially children leaving with their parents, and you don't have a way to estimate this, or you don't have very good data on those children leaving, this methodology would not work very well in your country, because it's important. You're kind of assuming this zero migration caveat that there aren't a lot of people necessarily going out or coming in. And the other thing that we need to consider is, because it's retrospective, over that between birth and going to school, there's, say, a 6-year interim period, some of those children would have died. So we have to factor in the infant and child mortality rate. And ideally, we would want to have this disaggregated by whatever we're looking at, say ethnicity or by region, et cetera, because we would imagine that different regions have different child and infant mortality, and that's going to play into this reverse survival to estimate births. A few other things to consider, and we also talked about this briefly yesterday, but it's worth mentioning again. What percent of children in your country attend school? Is it very high, 95% or more? Is it lower? If you have an estimate, are you also able to adjust your data by sex and ethnicity or geographic location in terms of school enrollment? Maybe it's high in some regions or lower in others. And for children that are in school, and maybe there's data, how complete is this data set? So does the Ministry of Education, does it only cover, say, urban areas, urban schools? Does it only cover certain provinces? You know, is it paper-based versus electronic? Does it only cover government schools? Does it, you know, if a large percentage or a sizable percentage, maybe not larger, children are in private schools or other types of schools, that's going to play into your analysis, and you would need to know that information. Another thing to consider is how you're going to look at the data. So how many children in the country generally attend kindergarten? Is kindergarten compulsory? Do a lot of people choose to go to private kindergartens, and maybe that's not covered in the Ministry of Education database, in which case maybe it's better to look at grade 1. That pushes you out, say, another year. So maybe you're looking at 6 to 7-year-olds instead of 5-year-olds, but your data might be more complete and you might have a little bit more sound analysis. So depending on the country context, will factor into who you would look at and what to use in your denominator. So let's say that we looked at school enrollment data for 2021, and we decided to go with grade 1 students because kindergarten is not compulsory, or a lot of people go to private school and we just don't have the data on it. So if we're saying grade 1, we would expect children to be roughly age 6 to 7. And again, this is 2021 enrollment, so born, you know, roughly 2014 or 2015. However, when we graph this data, we can see there's a few that are born, you know, later, and then there's kind of a sizable amount that are born before 2014. And so we want to know, are these errors, or maybe is something else going on in the data? You know, were these typos, or these errors, or something we don't understand? And depending on how the Ministry of Health calculates or collects or defines things, these actually might be special education students. You know, some of these would be adults, right? But these are defined on their level of academic achievement. So you could be, say, 21 years old, but you're only really at a grade 1 level academic achievement. You maybe still go to a special school, you attend school, so you end up in the database. So these might be accurate and real, but obviously they're not usable for our analysis. Because we're interested in, say, births in 2014, 2015, somewhere in that range. So in this case, it might make sense for us to query the database by year. So say we want all students enrolled that were born in 2014 or 2015. Excuse me. And so hopefully the Ministry of Education database has the date of birth of these students, and they're able to pull this information that way. So it just depends on the database and what they collect and what they can and can't do. But it's worth thinking about if if you say you query by those born in 2016, you might get a range of academic achievement, but you're not really interested in academic achievement per se. You really want to just get an estimate of births. However, if there is some kind of variable or maybe a flag for disability status, that would be a really important topic to examine in terms of inequality in birth registration. But that would also assume that your civil registry would also be able to disaggregate by disability or have some kind of flag or indicator, or maybe they could link via some kind of unique ID, national ID, so that you could do analysis based on disability status. So something to consider as you start, if you were looking at Ministry of Education data and doing some more analysis in this way. You may not have data to flag students with disabilities, so you might end up graphing and you get something like this. Maybe you have these older students in grade 1. And in this case, you would have to go back to the Ministry of Education and have a discussion with them and try to understand, are these errors? Are these real students? You know, they're based on academic achievement. How is the data put into the database? So it's just kind of important to understand what you are looking at. And then we, you know, similar to what we discussed with the DES, you'd also want to look at year-to-year variations in enrollment. Does it look pretty consistent over time? Is there anything strange going on in your data? Is there anything you would want to ask or discuss or whatnot? We would also want to make sure our coverage is pretty good in terms of the percentage of children in school and the regions of the country or the schools that are covered. And again, making sure our definitions align between our numerator and denominator, as we've discussed earlier today. So with that, we'll pause before we go to exercise 4, and I'll check the chat box and see if anyone has any questions or comments at this time. So if there's no, I'm going to just pull up exercise 4 on my end real quick. And then we can kind of review the first question together. So for the statisticians in the room, this is maybe when you can get excited. We're going to start looking at graphs and some numbers, which I know many of you probably like. Okay. So I will share my exercise. So again, if you go to the Google Drive and you want to open exercise number 4, we'll probably do something similar where maybe we can give you 5 minutes to kind of have a think about it on your own, and then we can go to the Jamboard and kind of post our responses and discuss. So let's start with this first question. We'll do one question at a time. Poplandia received school enrollment data from Ministry of Education for the years 2010 to 2016 by the mother's age and the child's year of birth. So we're looking here in this nice little graph. This is the age of the mother when the child was born. And then also each of these little lines here is different years of birth. So as kindergarten is not believed to be 100% complete, so that if in kindergarten in this situation, that would be children born in roughly 2016. Poplandia would like to perform analysis in 2015 or 2014 because these are the next most recent years. So looking at the graph for the school enrollment data for the years 2010 to 2016, what is your suggestion in terms of the years to do analysis on for birth registration completeness? So we'll give you about 5 minutes to read it over and have a think, look at the graph. And then if you want to put your sticky note on the Jamboard, let's see I'll also share that in 1 minute. We can see, I think we're on number 14. Yep, we're on slide 14 on the Jamboard. So I'll go ahead and share the Jamboard and you can start having a think about it. Okay, feel free to keep posting. I will want to keep moving because there's several different questions in this exercise, and I think it would be good to get through all of them if we can today. So we'll go ahead and go start with number 1 here. So there's some differing responses. A lot of people said 2014. Some people said 2014 or 2015. It says depending. Some people said maybe both. So we kind of have a range of responses here. And actually, I'm going to share my screen so we can actually look at the graph again together. So let's do that. Just go, there we go. Exercise 4. Okay. So here's our graph. And so what we are seeing here is that the shape of this curve is pretty consistent over time for all years, with the exception of this green line, which is 2015. So something different or strange is happening here in 2015. And the other thing to note that, so here's 2010, 2011, 2012, 2013, 2014, 2016. So it seems as though from 2010 on, the enrollment is increasing. So it's strange that 2016 is at its highest, but here we have quite low numbers for 2015, and the shape is not the same. So something seems strange or off about 2015. As we mentioned, 2016, we don't think we can use it because it would represent kindergartners, so we have to look at least 2015 or 2014. In which case, we would probably want to go with 2014 and maybe the years before that, because 2015 does not look right. Something is wrong. We'd want to check with Ministry of Education and understand why this is different or what happened. It doesn't match the pattern over time. So the answer to this is 2014 is probably our best bet, because we see this increase of enrollment. And so the other thing that we would just want to check or confirm, maybe from other estimates, that births were increasing over time over this, say, 6-year period, because then that would jive with what we're seeing in school enrollment, and that would make us also feel more confident about our data. So let's see here. If we did look at 2015, we'd have to be extremely cautious about our interpretations. So we'll stick to 2014 in this case. So we'll read question 2 together, and I'll give you a few minutes to think about number 2. So Poplandia received school enrollment data from Ministry of Education for 2015 and birth registration data from the Civil Registry Office for 2015. However, the first 100 records from Ministry of Education are missing information on students' ethnicity. There are about 10,000 records in total. Should Poplandia proceed with the analysis? So sorry, I just realized that I put the year 2015 here. Let's assume that we didn't just rule out 2015. I think I actually had meant to put, this was supposed to be, say, 2014. Because that's confusing based on the above exercise. But let's say that, we're not worried about the particular year, but what we are worried about now is that there's some missing records, and we want to know if we should proceed with the analysis. So based on what we know here, I'll give you a couple minutes and we'll go to the Jamboard, the next slide, and post your thoughts on if you think we should proceed. Okay, fantastic. So I'm seeing lots of yeses. It's only, 1% of the missing data. It's very small. And that's kind of what we're getting at. It's a very small number. We're not particularly concerned about that. The only time that we might be concerned about that is if we say we're going to disaggregate at an even more detailed level, and we start digging down to really, really low. So in this example, I said, what if we wanted to look at, say, ethnicity by province by age of the mother? So we're going like quite a small, fine-tuned lens. And in that case, we just want to make sure that for whatever reason, these records aren't specific to a certain province and that mother's age and that ethnicity, et cetera. If we start digging down, lower and lower and lower. But in general, this is a very small percent. We should proceed with the analysis. So everyone got that one. Fantastic. So let's briefly, we'll read question 3, and then I'll give you a couple of minutes to think this over. This is a little bit of a maybe a practical exercise of what could be done. So upon further review of the Ministry of Education data, it would seem that half of the records for the Eastern Province are missing mother's age. Poplandia feels that mother's age is a critical variable to analyze, and it also may vary by province. A 2014 census conducted 1 year before the year of birth, we're reviewing 2015, so 1 year before there was a census, that indicated that both the Eastern Isle and the Eastern Province had nearly identical age structures for women giving birth. So the percent distribution of births by mother's age were very similar between the Eastern Isle and the Eastern Province, according to the census. So the question is, can Poplandia proceed with the analysis of birth registration by mother's age by province? And if not, maybe what would need to be done? So here you can see the table of mother's age, and then these are the children enrolled in the Eastern Province. So you can see these are the number of records that have information, and then you can see these all are missing mother's age. But then we have some other information and sources. So maybe what is something that we could consider that we could do so that we can go forward with analysis of a mother's age by province for birth registration completeness. So I'll just give you a few minutes to think about this, and we'll post some thoughts to the Jamboard. Okay, so I see a lot of yeses, and a lot of you are kind of on to what we're aiming at here is using the existing age structure from another source. And then I realized I perhaps overcomplicated this example on some level because you already have the age structure information. But the idea was that if you have some data from another source, maybe you can apply it to the missing records, assuming you know, you have some reason to think that they're similar. So just here's the little summary. So we use the percent distribution of mother's age from the 2015 census for the Eastern Isle, and we just applied that to the missing records from the Ministry of Education. And the only thing is then we just need to add them together by the mother's age. So here is the kind of the final fixed table. So we took the percent times the missing, and then we got a new number. Sorry, this number here. And then we can add the enrolled that we already have the information for. We have these records, and these are the ones that are blank that we kind of redistributed. And once we add them together, we get a new total. And so now we have our total number of students, which is 304,000 enrolled in this Eastern province. And so you can look at the table in your own time if you want to just kind of go and match the math or whatnot. But the point of the exercise was just to kind of think about maybe there's some other sources that could help inform your missing records to make them a little bit more usable for your analysis. So let's go on to question number 4. And this is thinking about income and wealth quintiles. So Poplandia received recorded deaths from the Ministry of Health and registered deaths from the Civil Registry Office. The Civil Registry is able to link with the tax ID database to get income estimates for the deceased, and from that they can derive wealth quintiles. The Ministry of Health has predefined wealth quintiles based on self-reporting of families. So that means that perhaps when they come in and they make a medical record, the Ministry of Health asks the person, what is your income or what's your income range? And the person checks a box or writes it down that they tell them what it is. However, lower income families can get a certificate from the Ministry of Taxation to show that they are in need of subsidized health care, or maybe they can get special services if they can prove that they're low income using this, documentation from the Ministry of Taxation. There is a field in the Ministry of Health HIS records for these lower income individuals. So the Ministry of Health does collect data, and there is a variable in their database for those who have this certificate from the Ministry of Taxation certifying that they are low income and they're in need of subsidies. So the question is, can Poplandia perform analysis based on wealth quintiles? And then there are any factors that they should take into consideration. So have a think about these different variables and these different ways of thinking about income. And we'll post some thoughts on our Jamboard. I'll give you a few minutes, say 5 minutes or so, to think about this. I'm going to give you maybe 30 more seconds to post your thoughts if you haven't already. We have about 15 minutes left, so in the interest of time, we'll keep moving through the exercises. So if you haven't already posted your thoughts, please do so. So we have about 1, 2, 3, 4, 5, 6, 7. We have roughly 8 comments, and resoundingly everyone is saying yes. But I want to explore a little bit the intricacies of yes. So going back to the Word document. So the issue here is kind of how the data is being reported. So the linkage with the tax ID through the Civil Registry Office is great. There's not really any issue there. But the Ministry of Health, you could look at those who have a flag for being low income or subsidized through that perhaps certificate presented from the Ministry of Taxation, and that's great. So what you can do is you would be able to probably also define what is considered low income from Ministry of Taxation and then compare that to income that you see in Civil Registry. And in that way, you would be able to define your lower wealth quintile. So there's no problem there. And you can compare registration of the lower wealth quintile to all the other quintiles and to see if there's any kind of difference. Where this might get a little tricky is if, say, you were trying to make 5 quintiles and you define them based on the what Ministry of Health had. Remember that income is self-reported here, and income is something that is often not reported accurately or truly. So we would have to be a little bit careful with the self-reported data in this case. So in this case, we'd probably have to focus on just the lower income, lower wealth quintile, because those have a documented certificate coming from Ministry of Taxation. There's a flag in the Ministry of Health database. It's pretty clearly defined. So you would be able to pretty comfortably do that analysis and you could compare them to everybody else. But you probably wouldn't be able to compare, kind of analyze those other quintiles, or you'd have to do some with some extreme caution because it's likely that the data is not very robust being self-reported. The next question was, I'll read it and we'll talk about the response just in the interest of time so we can get to the last question. So upon further analysis, Poplandia realizes Ministry of Health only has records for subsidized individuals for the Western province. So only those that are being flagged as being lower wealth quintile, maybe with that documentation from Ministry of Taxation, only that information is available for one province. And the question is, can Poplandia perform analysis based on wealth quintiles? And I think most of you at this point understand, like, yes, they can. It might just be for that Western province, but that's still great. And what's good about that is they can use that information as an advocacy tool to try to get more detailed information in the future for the other provinces. So they can say, hey, look at this great information that we found. This was our analysis. And if we can get this information for other provinces, we can do that for them as well. And we can also look and see if there's variation by province and wealth quintile around the country. So it's a good starting point and a good advocacy tool. So let's go on to our 6th and final question in this exercise. Again, a nice little graph here. And we saw this in the PowerPoint, so this should look fairly familiar. So let's say Poplandia received several years of data from the Civil Registry Office. But note that in February of 2018, there was a big cyclone that caused a great deal more deaths than usual. So the question is, do you see this reflected in the data? If you come down here, this 2018 is this kind of purple color here. So do you see these deaths from the cyclone in February of 2018 reflected in the data? And This graph is, so these are registered deaths by month of occurrence. So this is not the month that they were registered. This is the month that these deaths occurred. So all of these deaths here, they occurred in January. All of these deaths here, they occurred in December. So that's how to interpret this graph. Do you need to be worried that these deaths were not registered, these deaths from the cyclone? When might there be an increase in May or June? Is the data quality poor, or is there a reason that deaths perhaps went up 3 or 4 months after the cyclone? So maybe have a look at the graph and have a think about it, and then we can post some of our ideas. And in this case, there may not always be right or wrong answers. So think maybe outside the box, or some things that could influence, or what could be going on. So sometimes we see aberrant data and it's real, or maybe there's an explanation, and it's important to include that. So have a couple of minutes to think about it and post your thoughts in the Jamboard. And if anyone would like to volunteer to maybe speak or think about it, we would love that as well. I'll put the Jamboard up on the screen for the next slide. It looks like I forgot to put the last question on there, so I'm just going to quickly copy and paste and put it up on the Jamboard. So give me 1 minute to get it up there. I'll maybe give everyone 1 or 2 more minutes to write their thoughts about what might be going on. And I would love a volunteer. If anyone wants to put their hand up and maybe give a short summary of what you think could be going on or explained from the data in the graph. And like I said, there's not really any right or wrong answers in this situation. Sometimes we're just thinking outside the box or thinking about different scenarios. Okay, anybody want to volunteer or discuss more what you have on your sticky notes? Nobody, everyone's feeling shy. Okay, so I see a lot of people are talking about delayed registration. When there's a cyclone, yes, a lot of times the infrastructure is damaged, or maybe you lose your documentation, or you're not able to register the death. Let's see, what else are we seeing here? Right, so what Turkey understood kind of what I was saying. We were saying the graph is on date of occurrence. So let me share that graph again. Let's see here. Okay, so if you look at this, this graph is by month of occurrence of the death, not month of registration. So all of these deaths here, they occurred in January. They could have been registered at any time within the next year, but they occurred in January. So we do see these deaths in February from the cyclone. But what happens when there's a cyclone? You know, we talked about infrastructure damage. Maybe the hospital was damaged. Maybe the water got polluted. People lost their homes. So it's quite possible that could have an impact. Maybe more deaths occurred from the cyclone, but there was a delayed impact due to lack of sanitation. Perhaps some people were physically injured. They end up in the hospital, but they died in the subsequent months. Or, you know, there could be a number of reasons that they were impacted by the cyclone that could happen. So it's quite likely that this data is real. Maybe there really was lasting impacts of the cyclone. If these are deaths that actually occurred in February but didn't get registered in April, they would have been put in the database as occurring in April. So that's a little bit of a data quality issue, but at least there isn't a huge delay. But I think the point of this exercise is we would need to investigate this a little bit more. So this is aberrant enough and different than the other years that we want to understand what was going on in this context. So when you first look at this data, you might say, oh no, this is bad. Maybe we shouldn't use that year. But then if maybe you're a resident in Poplandia and you think back, like what happened in 2018? Like, oh right, there was that huge cyclone and a lot of people died. Maybe this is real, and you could do some more investigation and think like, okay, yes, actually, you know, there was no clean water, or the hospital was severely damaged, or people died, or whatever, for whatever reason. And so you can help explain some of these unexpected data points. And so the point of this exercise was that you might get aberrant data points, and sometimes you don't know if they're real, and a little bit more investigation and thought needs to be put into it. And sometimes they are real, and then that just means you might need to explain a little bit more in your report or context to the reader why we see this. So this was the cyclone, this was lasting impacts, et cetera, et cetera. And then, you know, maybe you would want to go check with the registry office and just make sure, actually, oops, something went wrong when we pulled the data, it's an error, or it's real. So any questions or comments from any of the exercises, any of the lectures? I know we've come at time today for the end of the session. But I just feel free, of course, to email or to put things in the chat, or let's maybe have one last look at our Jamboard and see kind of, like I said, this is, there's not really any right or wrong answers, so maybe other people have thought of other things that could be going on. So we're still getting some of the responses coming in, which is great. So I will also save a copy of the kind of the answer key to exercise 4 on the Google Drive for everyone, if you want to go back and kind of look at the reflections and some of the thoughts and some of the exercises. It will be there for you to look at your leisure. And if there's no more comments or questions or thoughts, we'll let everyone go for today, and we will reconvene tomorrow and start looking at interpreting the results of our analyses and what they mean in terms of recommendations for policy and whatnot. Let's see, Panita just sent, oh yeah, she put the workshop page in the chat. Great. So. Okay, well, thank you, colleagues, so much. It was a great session today, and thank you for all of your comments and your post-its on the Jamboard. It's helpful to you know, initiate discussion and think about some of these exercises. So very much appreciated. Have a good rest of your day.